There are other causes of joint cartilage damage as well. We want to define what cartilage is, right? So it is the lining of the joints where your bones meet, and it provides cushioning support and lubricating mechanism whereby your joints can freely move. There are different kinds of cartilage. There's hyaline cartilage, there's elastic cartilage, there's also fibrous cartilage. But we're talking about hyaline cartilage for joint, which is the most common kind of cartilage that we have in our body. And pretty unique structure because it has the ability to give you structural support, but at the same time also a flexible in order for your joints to be able to move freely. The cartilage doesn't have blood supply, doesn't have nerve innervation, doesn't have lymphatic drainage, so it's a quite unique structure. When you have cartilage injury, you start feeling pain not because you have injury to the cartilage itself, but when it starts affecting the surrounding tissues in your joint or surrounding structures in your joint that have pain innervation, like the bone underneath it, or the synovial lining of your joint, or the joint capsule. And that's when you start having pain. There are different causes of cartilage damage. The most common, of course, is osteoarthritis. And osteoarthritis is a condition whereby the cartilage is damaged by a different mechanism. But what happens is that there's this chronic inflammation that happens in the joint that eventually becomes a perpetuator of degradation in the cartilage and the other tissues in the joint, creating other changes in the joint that creates decreased joint space, decreased lining or cushion, and inflammation and bone spurs, and eventually pain. There are other causes of joint cartilage damage as well.